Hi everybody, it's Joey Remenyi from seekingbalance.com.au. I'm a vestibular audiologist and neuroplasticity therapist, and I'm interested in vestibular disorders, dizziness, vertigo, tinnitus, inner ear conditions, and in particular, chronic invisible symptoms that are really debilitating for clients and people out there who I haven't met yet, but these are really serious conditions that often a general doctor or even specialist ear surgeons and neurologists, they can't explain. So it's Balance Awareness Week this week. So first of all, I want to start by saying happy Balance Awareness Week. I love hearing all of your stories. I myself, I've had distressing tinnitus. I've had severe vertigo and I've overcome it all. And I'm one of the lucky ones because I've had training and education. So I've now dedicated my entire career to educating people about sensory impairment and how to use the process of neuroplasticity to heal. Many of these symptoms are reversible. However, of course, they're uncertain. So we can never predict if I'm going to get tinnitus strongly again tomorrow or later today, or maybe I'll start spinning or getting vertigo again this week or next week. Who knows? I mean, I haven't had symptoms for ages now, but it's really important that people stay realistic, that yes, you can reverse symptoms. You don't have to live with them 24/7 and you're not stuck with them. So neuroplasticity helps us to reset, rewire, and rearrange the brain pathways so that you can genuinely feel normal again. In fact, most of my clients that go through the Rocksteady process or the Beautiful Balance support program process say that they feel better than before the incident or the injury or the diagnosis. So they actually go from feeling what was their old normal through feeling horrible and symptomatic and confused and lost and dazed to the neuroplasticity healing process and then feeling better than ever. So their balance improves, their sense of inner peace improves, their sense of connection to themselves and purpose and meaning in life. So this heartfelt connection to what is real to them, all of that dramatically improves. So what we're looking at is improved clarity, focus, dreaming, sensuality, sexuality, career, purpose, family, relationships. It really is a holistic process. So the words of wisdom I have for you guys listening today, and with particular regards to the fact it's Balance Awareness Week, first of all, it's not just vertigo and dizziness. Tinnitus is also an invisible, subtle symptom that many people will report makes them feel not quite right, or they'll say, I feel vibrations in my ears or my head. So I don't want people with tinnitus to sort of go unrecognized or unnoticed. I want to celebrate you guys as well this week. So I want to encourage everybody to not get fixated on your diagnosis. The main job of the medical doctor is to check you're not dying and give you what we call medical clearance, which means there's nothing sinister that they can foreseeably prevent or treat. So it's really important that you don't get stuck on this incredibly exhausting and futile goose chase of trying to get exact certain answers. So many of my clients who have now healed, by the way, but many of these guys had multiple diagnoses. They weren't sure which was which. You know, one doctor said this, another doctor said that. They're like, is it vestibular migraine? Is it Melder-Bachman? Is it triple PD? Now, as a vestibular audiologist, of course, I can help my clients navigate the probabilities and possible diagnoses, but to be honest, it's not my role. I'm highly trained in each of those conditions and how to support the healing, but it's the doctor's role at the end of the day to go through that diagnostic process. And I encourage all of my clients to trust their doctors. If you don't trust your doctor, find a new doctor, right? Because until you've got that level of trust, it's very difficult for you to heal. So first of all, don't be fixated on certainty and diagnosis. Trust it when your doctor says, this is the best I can give you. And as far as I can tell, you're safe, you're not dying. You certainly have medical clearance. From that point onwards, you can engage in a daily practice of neuroplasticity. Now, my second piece of wisdom for you all on Balance Awareness a Week is don't confuse neuroplasticity with generic visual therapies or vestibular therapies or, you know, these cookie cutter tinnitus retraining TRT programs. Like, all of that stuff is what I would consider old school. And neuroplasticity is something that nobody knows what it is until you're in the present moment. Okay, so it's not like, okay, repeat this 3 times a day and now do this and now try that. It's not this old kind of prescriptive model. Neuroplasticity is when you look at physical, mental, emotional, and spiritual aspects of your reality in the present moment and you directly respond to that. So every single person has a different neuroplastic program every single day. All of my clients are different, and that's why this process is so heartfelt and so rewarding, and it's why we get such amazing results. So if you need to strengthen your legs, then on a physical level, you're going to have leg strengthening exercises. If you're experiencing extreme self-doubt and persistent worry, then you're going to have those mental exercises to help you lean in and learn how to work with that persistent worry and self-doubt. If at an emotional level you're experiencing frustration or anger or anxiety or depression or isolation, then at the emotional level, you're going to have neuroplasticity exercises to work with those emotions and to cultivate emotions that you ideally want. At the spiritual level, if you don't believe your recovery is possible, if you don't want to do a home practice, if you don't believe in healing, if you don't believe in yourself, at the spiritual level, that is where you need to work. Like, the only way you can change and you can reset your spinal column pathways, inner ear, eye, brain, and proprioceptional skin, the only way you can cultivate and use neuroplasticity is to believe in yourself and your body. I've seen so many recoveries, I can't even count them anymore. I've personally recovered myself. So I know it's possible. I believe in my body and I believe in my clients. But I tell you, the biggest barrier to healing is that spiritual aspect. If you are looking for a physical, eye exercise or gym routine, you might get stronger eyes or you might get stronger muscles, but that doesn't mean you're going to heal at the mental, emotional, spiritual level. So just bear in mind that your physical therapists are limited. Their training really stops at the physical boundaries. And so the mental, emotional, spiritual things can go undiscovered, unexplored, undiscussed. Same with your doctors. Your doctors are excellent at identifying physical issues in your blood results, in your brain scans, etc. They're masterful at it. That's what they've done all their training in. So at that physical level, that's what your doctors are going to give you information on, the assessments, the test results. They're less likely to have any training in mental, emotional, and spiritual aspects of your recovery. If you don't believe in yourself to start a daily program and learn what neuroplasticity means to you, it's just unlikely you're ever going to engage in it. So the process won't exist for you. So what I encourage you to do is just stop and pause and ask yourself, am I ready to learn about neuroplasticity? Am I brave enough and courageous enough to start asking myself, what does this mean to me? Because what neuroplasticity means to somebody else is totally different, and that's their journey and their process. So you might be thinking, well, how do I get started? Where's the YouTube video on neuroplasticity, get started today? I can't create a video that says, do this now, start this now, because everyone is so different. That's why I built a 12-week program called Rocksteady. You can join a live Rocksteady program if you want my support live over 6 weeks. That starts October 16th, which is coming up in less than a month. But Rocksteady is a self-study process. You do it at home. You don't need me. You click play, you listen to audios, you watch videos, you go through worksheets and questionnaires. And the process gets you to ask these questions to yourself and learn how to find your own answers. Because the truth is I don't have the answer for you. What I have is a process and a skill set that helps you find your own answers within your own inner wisdom. Because if there's anything I have learned over the last 10 or 12 years, it's that the human body is remarkably intelligent. Your heart knows what to do. Your lungs know what to do. Your skin knows what to do. Your eyes and your ears, they know intuitively what to do. Your body is intelligent. The question is, how do we get our mind and our belief system and our emotional system and our body to all work together as an intelligent team so they're not having this inner conflict and effectively arguing with themselves? Where the mind says, I want to do this, I want to feel this, I want to get back to work, I want to push through, I'm over this, I want answers. And the body might be saying, actually, this isn't working for me. I need to change a few things because I'm feeling depleted and malnourished. Or it could be that the emotions are saying, I don't feel safe. This is not working for me. And it could be that on the mental level, there's whole dreams and ideas that are being unexplored in your personal inner life. And at that soul level, at that deeper level of life, there's a void, there's a vacancy. So I want to encourage you all to just go beyond the physical. We're not talking visual therapies, vestibular therapies, physical therapies, testing, diagnosis. You need, I mean, it's important, and I love that process. It's actually really wonderful, but it's a tiny piece. Like beyond that, you've got to go, what's happening for me mentally? What's happening for me emotionally? What's happening for me spiritually? And how can I weave together a program every day that's giving me what I need in all aspects? So neuroplasticity is really a gift, and it's not just a gift to your condition or your symptoms. It's a gift to you as a person. It's a wholehearted process. Join my Rocksteady Facebook group. It's called Rocksteady for Vertigo and Tinnitus, so you can freely access that. I have loads of free programs if you're on a tight budget. If you've got a little bit more money to invest in your process, it's still an economical investment. Go the live Rocksteady program where you can work with me. Email me. You'll have 6 weeks of support as a group and live interactions. And for those of you who are introverted and would like to do things in your own time, you can also go through the Rocksteady process whenever you like, at home, in your own time, fully empowered, and you can just quietly go through the process on your own. That's why it's self-study. If you're looking for private therapy and you would like to work with me one-on-one over a 6-month process, that can get the deepest and fastest results, actually. That's my Beautiful Balance program. Go to my website, seekingbalance.com.au. You will find all of the programs, free resources, self-study programs, and private therapy options. Reach out if you'd like an initial consultation with me. I can help you get this process started. No, I can't do it for you, and I'm not claiming any form of miracles, but once you've got medical clearance, the next step for you is healing with neuroplasticity, and that is a multi-layered, subtle and complex process that goes way beyond the physical. So with that, Happy Balance Awareness Week, that's for both vertigo and tinnitus sufferers, and also for people who have recovered. You know, you inspire us. If you have a recovery case study, contact me, because I would love to share your recovery case studies with the world. To learn more about healing, go to seekingbalance.com.au and reach out if you want support. We're here to support you. Bye for now.